Hello everyone, my name is Thao Nguyen. Today I would like to talk about my community, Town Country in Hillsborough County, Florida. For 1950s, Town Country was a cattle farm. It provided beef and dairy products to an expanding Florida population. The suburbanization had occurred when the Lamont Simper Corporation purchased a 525-acre dairy farm in 1958. This corporation started to construct the Town Country Park subdivision during the 1960s to 1970s and made this area one of Tampa's first suburban communities. Until 1978, more than 8,000 single-family homes and townhouses were built and sold by the Lamont Simper Corporation due to an explosive population in Town Country area at that time. Today, Town Country has become larger area than the original 2,000-acre. Is a subdivision of Tampa City and located in western Hillsborough County. Is bordered by Pinellas County and Osmar on the west, Tampa Bay to the south, Tampa International Airport on the east, and Lightbound to the north. Town Country community provide adequate infrastructure needs for all residents living in the community. For example, food store like public Walmart, healthcare store, civil Walgreens, hospital and healthcare clinics like Tampa Community Hospital, Tampa Family Health Center, fire rescue station, public and private school and public library. Transportation system with many highway, roads, international airport, and harbors, churches and temple, park and recreation for all residents in different ages. Some structural issues like flooding in many areas of Town Country community due to the outdated drainage system. Town Country infrastructure has some pipeline over 100 years old in all three systems: water, wastewater, and stormwater. Heavy traffic congestion, like driver may spend approximately 27 hours to drive during heavy traffic congestion in 2016. It may due to dense population reconstruction project and downgrade road condition. The current population of Town Country communities is more than 84,600 residents within 37 square miles. With the dense population, Town Country is ranked third place after Tampa and Brandon area in total population of Hillsborough County in 2015. Some issues related to population such as road and transport congestion, increasing risk for air pollution and water pollution, potential loss of greenbelt land for building more houses and roads, increasing rate for violent crime and homicide. For example, Hillsborough County had homicide death of 52 and violent crime of 4.9 to 6.3 per 100,000 people in 2017, comparing to other counties in Florida. According to the U.S. Census Bureau, an urban area must have a population density of at least 2,500 people per square mile. On the other hand, population density of rural area is less than 100 people per square mile. As you can see on the chart, Hillsborough is urban county with 250 cases of AIDS in 2007. During the period of 1993 to 2007, and there were more than 73,000 people diagnosed with AIDS in Florida. Most AIDS patients was in urban counties, with only 2.7% in rural areas. Because of the complexity of HIV and AIDS treatment, rural residents may have more barriers than urban residents in accessing quality HIV and AIDS care. Rural areas likely have a low density of doctors and hospitals, lower moderate and lower emotional and social support for AIDS residents. A study was conducted to check for the survival rate of AIDS patients in both rural and urban areas. As a result, there was no significant differences in the 3, 5, or 10-year survival rate between both areas. Older age at the time of diagnosis during the 1993 to 1995 period, unknown transmission mode and lower CD4 count were associated with lower survival in both areas. In urban area only, being non-Hispanic, Black, or Hispanic, being US-born, more poverty, less community social support, and lower physician density was also associated with lower survival rate. There are sufficient health resources for residents in the town country community such as hospital, healthcare clinics, rehab centers, assisted living facility, drug addiction center, and various pharmacy. People can easily find the specific places to obtain healthcare screening, immunization, medical treatment, medication, or medical assistance. These places accept every patient, and the healthcare fees are affordable because these places accept various insurance forms. They offer monthly payment and provide discount for low-income people or veterans. Three objectives of Healthy People 2020. First, access to health services. Increase percentage of Hispanic adults with dental care in Hillsborough County to 60% by the end of year 2020. In fact, fewer Hispanic have health insurance and dental care compared to white and Black non-Hispanic in Hillsborough County. They are unable to afford healthcare services due to expensive fees. The percent of Hispanic receiving dental service were increasing from 46.6% to 52.6% in 2016 due to many assistance programs and to provide low cost and free medical and dental care for senior residents, unemployed, low income, and residents without insurance in Hillsborough County. Second, HIV, reducing the rate of HIV infection cases in Hillsborough County to 2.3 by the end of year 2018. The rate of HIV infection cases have been reducing from 2.8 to 2.6 in 2016. Hillsborough County has applied the perinatal HIV program, routine HIV and STD screening, quick diagnostic tests and treatment, and community education for high-risk residents. Lastly, smoking, reducing the percent of adults who are current smokers in Hillsborough County to 14% by the end of year 2020. According to the Florida Department of Health, the percent of current adult smokers were reducing from 19.7% to 16.1%, and many tobacco prevention programs have been applied to reduce the prevalence of tobacco use and reduce exposure to second-hand smoke. Many facilities are tobacco-free, such as school, healthcare settings, and government offices. Residents in town country community receive adequate environmental resources such as water supply from Hillsborough River. Wastewater is controlled by the city obtained by wastewater department. Solid and hazardous waste are collected by Hillsborough County Disposal Services. Good air quality index with many trees and natural parks in town country community. Some environmental issues such as risk for air pollution due to high number of cars which providing carbon monoxide, dust from the construction sites, and tobacco smoke. Water pollution from chemical waste products, trash, dead animal, or leaking wastewater. flooding due to the outdated drainage system and heavy rain. People in town country can get assistance from government and political offices by applying form online, through email, spread newsletter, by phone, or directly to the offices. Also, residents can attend monthly community meeting, public hearing to propose the concern related to community issue and funding sources for the whole Hillsborough County. The fiscal year FY16 was spent for numerous community projects such as school, stadium, fire service, government facility, library services, stormwater transportation, public utility. Some issues related to economic, political, and public policy. First, budget crisis for Hillsborough Public School to keep cutting costs and reduce teacher assignment. District need to invest new strategy to improve graduation rate and academic performance. Second, new construction for Tampa Bay Rays Stadium to replace outdated Tropicana field in St. Petersburg with public money. There is still no perfect solution. Lastly, Sikh community needs relieve traffic congestion by expanding side-up roads, rebuilding road appearance, and using alternative mode for transportation. The action can help reduce the number of deaths and injuries from car accidents and air pollution. Maintain drainage facility in good condition to avoid flooding or water pollution. Strictly monitor for communicable disease, especially HIV, AIDS, and STD in the community by providing vaccination, screening tests, medical treatment, and medication for high-risk people. Regularly perform regional health assessment to prevent chronic diseases, and provide community education on annually physical checkup, follow treatment regimen, avoid risk factor, and pursue healthy lifestyle. Restrict smoking on school campus, government buildings, and healthcare settings to prevent secondary smoking and reduce the number of health conditions and deaths related to smoking. Encourage physical activity for children and adults to reduce risk for heart disease, obesity, and maintain good health function. Thank you for listening. To my presentation.